Hi, this is Roseanne Fraser. I'm doing the abdominal assessment. Let's begin. This is my patient, Kendall David. And we'll start. So we'll first begin by doing inspection. We're just looking at the shape of the abdomen. Looking for any bulges. Pretty much looking at the contour. Looking for any waves, any movement, any pulsations from the aorta, or any waves at the bowel sounds. And then we're gonna, the next stage is auscultation. We're gonna auscultate all four quadrants, starting with the right upper quadrant using the diaphragm of the stethoscope. And then move over to the left upper quadrant. The right lower quadrant. And the left lower quadrant. And you're supposed to hear like pinging and tinging of the bowel sounds. It's supposed to be between 5 and 30 per minute. And then we'll go to the aorta, which is right above the umbilicus, using the diaphragm or the bell. And the aorta splits off into the iliac artery and the renal arteries, which then splits off into the femoral artery, which is down here. And then you listen to it on both sides. And then you just listen for any vascular sounds, any, bruise, and things of that sort. So now we're going to do the next stage, which is percussion. So we're going to percuss, taking the middle finger of the dominant hand and striking it with the distal joint of the non-dominant hand in all four quadrants. Just a light strike. You'll hear like a tympanic sound, which should be the sound like of a drum. A drum, because the belly has a lot of air inside of it, so it shouldn't be filled with any fluid or structures that causes it to become dull. And now we're going to percuss to find the liver border. So we start at the mid-clavicular line. And we're moving upward until we hear the dull sound. And then we start percussing in between the ribs. So hear the dull sound to find the edge of the border. It should be between 4 and 7 centimeters. And the same thing you could do for the spleen. You find the 10th rib, the intercostal space. We know the bottom is the 12th rib. So we go upwards at the axillary line. And we're percussing. Till we hear a dull sound. Take a deep breath. That means that the spleen just moved upwards. So there's no spleen enlargement. So the next part is palpation. We're going to palpate all four quadrants. Lightly palpate the right upper quadrant, the left upper quadrant, the right lower quadrant, and the left lower quadrant. That's just to, get the patient familiar with your touch and, loosen up the muscles in the bowels. And then you go into deep palpation. On the right side of deep palpation, you're looking for the main structure, which is the liver. And the gallbladder, which is right behind it. On the left side, deep palpation, you're looking for the main structure, which is the spleen. The right lower quadrant, the main structure is the appendix. In the left lower quadrant, the main structure is the colon. So when you deeply palpate the right upper quadrant, you want to use something called the hooking technique, where you put your fingers above the rib cage and try to press underwards to get your fingers under the rib cage to feel the edge of the liver border. There's a condition called the Murphy sign that if a patient takes a real deep breath and there's it ceases they have to cease inspiration due to pain, that could be a sign of the inflammation of the gallbladder, cholecystitis. That's called the Murphy sign. In the right lower quadrant, you want to look for the anterior superior iliac spine. And once you find the anterior superior iliac spine, you will go above to the umbilicus, about 2/3 of the way down between the imaginary line. This is called the McBurney's point. And that's the point where the gallbladder sits right below. In deep palpation there, if there's any pain, that could be indicative of appendicitis. Another test you can do for appendicitis is the rebound test. This is where you press in deeply into the right lower quadrant, and you ask the patient, and then you suddenly let go, and then you ask the patient what hurts more, the initial pressure or when you let go. That could be indicative of an appendicitis as well. So another test that can be done for appendicitis or peritoneal inflammation is the ileal SOS sign, which is a type of test where you find out if the patient has any pain in this area here. So I'm gonna have you press your leg against my hand, and press this against my hand. Okay, so if there was any pain in this area here, that'll be indicative of appendicitis or peritoneal inflammation. Another test that we would do is the obturator sign, where I'll have the patient bend the knee, and then we'll do an internal rotation and an external rotation. And if he has any pain where the McBurney's point is in the right lower quadrant, that'll be indicative of an appendicitis or peritonitis. And now the last set of tests will be testing for ascites. Obviously, he doesn't have ascites, but if he did, it'll be a round protuberant stomach. So you'll percuss each area. You'll percuss around the abdomen, where you expect the protuberant abdomen will be tympanic, it'll be air-filled, because as you lay flat, the ascites will go to the lower areas. But as you percuss the flank areas where the fluid is, it will be dull. So when it's air-filled, it's tympanic, and where the fluid is dull. Then I'll have the patient roll to the side. And if he has ascites, all the fluid will shift to the dependent side. So if I percuss on the flank, it'll be tympanic. because the fluid has shifted. Now, lay flat. Remember, bring your arm right in the middle, right. So now the last test would be the fluid wave shift. So say now he has the protuberant stomach. So I would tap the side of the abdomen and just feel the fluid go from one side to the next. And that'll be positive of the fluid wave shift. And that completes our abdomen exam. Thank you and good night.